My name is Anat Loewenstein. I am the chair of the Department of Ophthalmology at the Tel Aviv Medical Center and vice dean at the Vascular Faculty of Medicine at the Tel Aviv University. I presented here at the ARVO at Baltimore the results of our UNRAVEL trial. The UNRAVEL trial was a multi-center trial which was conducted in 24 centers in 7 countries, aiming to assess the influence of Ranibizumab and Aflibercept on the levels of systemic VEGF. Ranibizumab and Aflibercept are both anti-VEGF agents, namely they suppress VEGF. Since both drugs also penetrate to the systemic circulation, they have also an influence on systemic VEGF. And since VEGF is an important cytokine for blood vessels integrity, then the suppression of VEGF can be significant. The UNRAVEL study showed that in the group of patients which were injected by Ranibizumab, there was no decrease in systemic VEGF levels at all time points. In the group treated by Aflibercept, there was a more significant decrease in systemic VEGF levels in a statistically significant manner. The results of the UNRAVEL did meet my expectations, knowing that Ranibizumab has a shorter half-life in the systemic circulation. What was a little unexpected is that there was a large proportion of the patients in whom systemic VEGF levels were not detected. And this is because all the assays for VEGF levels are very problematic and are influenced by clotting factors and other systemic conditions. So in that way, we found the results a little disappointing because a relatively large proportion of the patients did not have detectable VEGF levels, so could not be part of the analysis. The clinical implications of our study are, first of all, that both drugs have some influence on the level of VEGF in the systemic circulation. Our study has shown that the decrease in systemic VEGF was greater with Aflibercept as compared to Ranibizumab. We do not know exactly the clinical implications of this finding. However, it does show that there is a difference between the drugs.